Our first age-friendly partnership meeting of 2021. We're really pleased so many of you could come today. And for those of you who don't know Bristol Ageing Better, we are funded by the National Lottery Community Fund, and we're one of 14 Ageing Better areas in the country, set up to trial different ways of tackling social isolation and loneliness in people aged 50 and over, and to collect evidence on what works and what doesn't. So over the past 6 years, we've worked with partners across the city to deliver a range of different projects, including Age Friendly City. So if you're new to the age-friendly concept, it's simply about creating communities where people of all ages can live healthy and active lives. And
this is the captioner. You need to slow down a little, I'm afraid. Sorry.
Okay. So Age Friendly is a framework to enable people to feel valued, enable them to participate and contribute fully to their community for as long as possible. And creating age-friendly places involves all of us working together. It's about changing attitudes, changing cultures, and changing behaviours. So Age Friendly City is a key area of work for us here at Bristol Ageing Better this year. So we thought it would make sense to bring back the partnership meetings with a focus on the 8 domains within Bristol's Age Friendly strategy. And really just to help spread the message about what age friendly means and how we can all be a part of making Bristol a better place to live as we age. Our partnership meetings have always been a chance to bring people together from different sectors across Bristol to connect, share and learn from each other. And by coming together like this, it really gives us an opportunity to find out about some of the brilliant work that's already happening in the city related to each of the themes, but also to reach out to partners like yourselves who are keen to connect with Age Friendly through the work that you do. So as you all know, today we are focusing on communication and information. And before we get started, I'll just run through some housekeeping and what to expect for today's event. So just to let you know, we will be recording today's event, and that's just so that we can share it with those that couldn't make it. But when we do share the recording, we remove everyone's names so they aren't showing. As I said at the beginning, we are using live captions today. So to turn this on and off, please use the closed captions button at the bottom of your screen. We're kindly joined by Jo Stokes from Age UK Bristol and Emma Dyer from Alive, who will be talking about the projects that they've been involved in related to communication and information. And we will be keeping everyone on mute during the presentations, just so that we can hear the speakers clearly. But there will be a chance to ask questions at the end of the presentations. So feel free to either type your question in the chat box, or you can raise your hand using the raised hand function, or just physically raise your hand, whichever suits you. At the end, we'll then have a quick 10-minute break, just to stretch our legs before we head out into breakout rooms. And the breakout rooms are going to be a chance to reflect on the information and communication topic and how it relates to our own work. Each room will be facilitated, and what we'd like is to hear your ideas about how things can be improved for older people using all of our knowledge, skills and our platforms. And then at the end, I'll just share some details of upcoming events and how to keep in touch with us. But first of all, I would like to welcome Bianca Rosetti from the Bristol Ageing Better team. Bianca is our project officer, who has been with the programme for a number of years working on different projects, but she's now focusing solely on Age Friendly City. And Bianca's going to set the scene for us today by giving us an overview of what Age Friendly communication and information is all about. So over to you, Bianca.
Thanks very much, Laura. Bear with me a moment, everyone, while I just share my presentation. Sorry, just a moment. It doesn't want to go. There we go. Wonderful. So, hello everyone. I'm Bianca Rosetti, and as Laura mentioned, I've been working as the Age Friendly Project Officer at Bristol Aging Better since 2010, and I've been with the BAB team since the programme launched in 2015. Age Friendly City work is not new to Bristol. Joining the WHO's global network of age friendly cities was identified as one of the primary aims of our programme from the outset, and was included in the city's bid to the lottery's Fulfilling Lives Aging Better Fund in 2014, with Bristol achieving membership of the network in 2018. In order to join the network, we needed to complete a baseline assessment, so that meant bringing together national and local data sets and also having meaningful conversations with our older citizens, a charter which was created with older people to set out 9 clear visions for Bristol, where age is no barrier to enjoying and fully participating in city life. And then from there, create a strategy to address areas for improvement and to make the most of the assets we already have in the cities. So the city's design, infrastructure, the voluntary sector, our culture, and most importantly, what people are already doing and building in their communities. So all of what I've just outlined is done through the World Health Organization's framework for age-friendly cities, which groups the patterns identified in urban areas that are best meeting the needs of ageing populations under 8 domains, as Laura mentioned earlier. So the 8 domains are outdoor spaces and buildings, transport, housing, social participation, respect and social inclusion, civic participation and employment, community support and health services, and communication and information. So you can see here a diagram created by the WHO, which further groups them under 3 headings and uses slightly different titles for domains in some cases. And there are more person-centered ways to express the concepts too, such as we used in our podcast project, Here We Grow, where transport was renamed Navigating the City, and Feeling Well for community support and health services. I believe it was Connected for communication and information, and so on. So as you can see, age friendliness has many facets and encompasses a huge range of concepts and aspects. Essentially, it's everything that changes in our inner world and the world around us as we age, and how organisations working in a place can be aware of and responsive to those changes. So we're now at the implementation stage of Bristol's age-friendly journey. The journey doesn't end with the WHO recognising us as an age-friendly city. It simply means we have a good foundation of knowledge and good connections to be able to take things forward if we keep up momentum. And that's why we're holding these 8 partnership meetings between now and March next year, to convey the knowledge base we already have under each domain, and to invite other organisations and individuals to bring their perspectives and ideas for solutions. We're starting with communication information because, as my colleague Jo will explain later, we're doing some focused on the ground work on that area over the next few months. And it's an area that's seen a huge amount of change since March 2020. So why is communication and information a vital thing to consider when assessing the age friendliness of a place? Well, a majority of other age friendly features of a place depend on it. If people aren't enabled to stay connected to people and have access to information to manage practical needs and find out what's going on where they live, they will face barriers to living the life they want to live. I do want to caveat this overview by saying that the lens of age-friendly communication doesn't mean that people suddenly start speaking another language, or they should be spoken to as a homogenous group when they pass an arbitrary age threshold. But there are some common changes that can occur in the second half of life, both biological changes and also changes in how people are often spoken to based on their age or their perceived age, which can affect access to information and communication channels. So firstly, let's look at the kinds of information for which age friendliness is high on the agenda. So statutory and voluntary sector services, things such as benefit forms, communication from the NHS, library services, local helplines, and literature or adverts for services and events or groups. If these are difficult to navigate for older people, it can significantly lower people's ability to live independently and as they choose. Local media, so newspapers, listings guides, radio, television news, web-based news platforms, and any stories written by or about old people can again affect access to public interest information and keeping connected with city life, as well as people's sense of self and agency. And then retail, hospitality and cultural venues, places in the city people visit to meet practical and social needs. So what changes are common in later life that can affect communication and information access? First of all, it's important to say that none of these changes that I'm about to outline are unique to later life, and nor are they synonymous with later life. In fact, health conditions and mental well-being can improve in later life, but they are most common over the age of 50 and can be gradual and more difficult to adapt to for people without full-time caregivers. So firstly, sensory changes. Changes in vision and hearing can affect individuals' capacity to absorb information. Over half of people aged over 60 in the UK have some degree of hearing loss. 20% of people aged over 75 are living with sight loss, and the leading cause of blindness is age-related macular degeneration. If information is difficult to hear or uses small print or inaccessible design, it can affect people's sensory loss as well as deaf and blind people. Physical changes. Natural changes in our bodies as we age can include lower muscle mass, declining flexibility and mobility, changes in fine motor skills, and reduced hand-eye coordination. Health conditions and disabilities, including arthritis and osteoporosis, can also make using buttons and touchscreens difficult. Cognitive changes. Aging can change people's cognitive function in many ways, with many of the changes common in later life being positive. For example, trends in vocabulary, articulation, and happiness levels. But some people do experience changes in their cognition in later life without having diagnosis of dementia or brain trauma, such as reduced memory retention, difficulty remembering appointments and future commitments, being slower to process information, or difficulty switching tasks or attention. And onto a hugely and increasingly important topic within this field, digital exclusion. So in the 2019 survey of Bristol Older People's Forum, 61% of respondents said that they access the internet, leaving 39% not online, and that was 265 people. Of that 39%, a majority stated that they had no interest in doing so. Bristol's Quality of Life survey in 2020, which is around 4,000 Bristol residents in total and completed paper and online, showed that the likelihood of being uncomfortable using digital services increases with age. The percentage of people who state that they are unable to afford home broadband or equipment also increases with age. To compare this with some national data, the Lloyds Bank UK Consumer Index 2021 found that 32% of people who are not online say that nothing could motivate them to get online. That's down a third since 2020, and it's down really quite significantly since 2018. So it does show that there are increasing numbers of people who are less resistant to being online, or who have found kind of ways to get online that they're more comfortable with. So for those who like that information presented in a chart format, here is an ONS chart showing the proportion of internet non-users by age. So you can see here that the age weighting for online exclusion is actually increasing 10 years ago. So if you look at 2011 on the left-hand side, there's a more even spread of ages in the offline group, whereas looking at 2018, internet on non-users accounted for over 50% of people who weren't online. So so you can see that there's a much larger proportion in the older age group, is what I meant to say there. So on to another important piece of the puzzle when considering communication, information access in later life, ageism. So ageism is a bias from one age group towards another. It includes the use of negative and inaccurate stereotypes, prejudice and discrimination against people based on their age. There's a huge amount of evidence that shows that ageism is widespread in society. It can be found in workplaces, healthcare settings, stereotypes perpetuated in the media, and adverts aimed at older people. To combat this pervasive form of discrimination, the diversity of older people needs to be recognised. people treated as assets rather than as a burden, and older people represented in local media rather than spoken about as an other to be done to or excluded from a conversation that the rest of society is having. So with all of that in mind, what changes would people in Bristol like to see? So here's what's come up most significantly in conversations and consultations we've had and the older people we've worked with. Providing paper and online versions, so making it simple for people to request printed information and provide it to community venues as well. People were really clear that they did not want to be swamped with unsolicited mailings, but most people would like a local newsletter, something like the Voice magazines, the Pigeon, Vocalise, etc. Availability on the phone, so being able to call someone to arrange or access council services, ordering groceries, find out venue hours and accessibility, and banking needs. And the third key recommendation has been positive representation. So more diversity in the over 50s, presenting, acting on our screens, writing. People want to see later life shown and spoken about as people really experience it, rather than the all too often represented time of decline or isolation. And so before I hand over to some of our partners who've been doing exemplary work in this area of age friendliness, here's another significant insight from the BOW programme, which shows how people found out about our projects and activities. Of the 3,000 older people who completed feedback forms for us, more found out about it through paper advertising than any other advertising channel. And we did reach people with particular risk factors for isolation, such as carers, people who've been recently bereaved, and others. So that suggests that it's important to keep using paper, helpful though digitisation can seem, if you want to reach the people most in need of new connections or wellbeing services, things like that. Great, well, thanks very much for listening, and I will pass over to my colleague Jo now.
Thanks, Bianca. Wonderful. Okay, hello everyone. It's lovely to see so many people here today, and lots of familiar faces, but also lots of new ones as well, which is great. So I'm just going to try to share my screen, my presentation. Right. Is that showing? Bianca, can you give me a thumbs up? I can see you. Is that okay? Yeah, cool. Thank you. Okay, so my name is Jo Stokes and I work with Age UK Bristol as the Community Services Manager. Some of you will know about Linkage and will know the organisation, but just to explain, Linkage was a local charity that worked with older people, and just as the pandemic started, April last year, we merged with Age UK Bristol. And it was beautiful timing from the point of view of the pandemic, because it meant that we could bring our community work into Age UK Bristol and reach more people. So I'm starting the presentation by talking about how we've adapted activities and information during the pandemic. And a lot of this work's been done both by Age UK Bristol, but also by partners that we've worked with through the Support Hub in Bristol, which is a collaboration of mostly charities across the Bristol area working with older people that came together during the pandemic. And I think one of the audiences that many of us have tried to reach before the pandemic, as well as during, is socially isolated people, especially socially isolated older people for our charities. And the pandemic and lockdown just made this group bigger. It made them even more isolated, and the job just got harder. And we hadn't solved the problem to start with. So how on earth were we going to reach people when they could be struggling even more? So I think we, as well as many other people, had to get creative. We had to innovate. And we found that people tended to fit along a spectrum. So those that were comfortable with more familiar technology, and then those that were sort of more like the tech wizards. And I think what it shows is, as people fit along that spectrum, that there's a need for diversity around how we provide information, but also how we communicate with people. So there's something about how we provide that diversity to meet different people's interests, abilities and needs. So starting at one end of the spectrum, familiar technology. So some examples of how Age UK Bristol and partners use familiar technology to reach out to people. And I'm going to include information about the barriers that we found along the way as well. And it's not because I want to be negative, it's because there's no one perfect way. And I think these are all things that we have to consider when we're reaching out to people. So starting with the telephone, Age UK Bristol use the telephone in many different ways to connect with people. Most people have a landline. Some people use a smartphone or a mobile as well and are very comfortable with it, but most people will have a landline. And we used it for telephone befriending alongside a lot of other services. We had telephone groups using teleconferencing software. We provided information and advice over the telephone. We did online shopping with people over the telephone and took details for prescription collection. We also had a helpline, we still have a helpline for the support hub, which served all older people in Bristol and signposted and referred them to the right services. But even with the telephone, we all know that there are some barriers. So it doesn't always work as well for people who don't hear well in some contexts. So for instance, a telephone group with someone who doesn't hear well can be quite difficult because there can be several voices on the phone. Or someone who has a memory problem, remembering that so the phone is going to ring at a certain time and who that person is can be difficult. And obviously if someone doesn't have a phone, so someone maybe who's of no fixed abode. We also are experimenting using the TV. So we are rolling a pilot out at the moment with Sparko TV, which is a private product, but it uses someone's TV that has an HDMI portal, and it can facilitate live sessions through the screen. It can also have local information loaded up onto it. And the idea, the concept, the original concept is around reducing isolation and bringing your community into the front room. Older people can facilitate their own live sessions. So one of our members facilitates a poetry group across the nation using Sparko. But you can also have a telephone call through it with friends and family. Again, there are barriers. We really need to take into account cost. People need an internet connection. And people with sensory impairment or cognitive impairment, there are barriers there again. But they're not unsurmountable. It's just that more support might need to go in. And then there's also the printed word. And as Bianca's already raised, people do like to have things written down and posted through the door or available in public spaces. So over the pandemic, we have been producing a joint newsletter with the Bristol Older People's Forum and the Council. I think this is a problem that isn't completely solved. I think anyone who's tried to produce a newsletter will know that it gets very expensive very quickly, producing more than 1 or 2 pages. But it is a really effective way of sharing up-to-date news with people. I think there's also more space for people who are age 50 plus to contribute their writing to it, to design what goes into it, to have editing rights. So I think there's more we could do there as well, and that's something that I'd like to do. If we follow up the spectrum, we get to the tech wizards. People increasingly are using lots of 21st century methods to stay in contact, no matter what their age. So Age UK Bristol, we've used Zoom. For instance, we have an art club that meets weekly on Zoom and still does. That was started during the pandemic. And while the original intention was to enable a way for people to get together, there were unexpected outcomes as well. So some group members were proficient in Zoom already, but some group members needed support from a tech volunteer. And they did learn how to use Zoom more and more comfortably each week. So we had someone who couldn't use it at all at the beginning who can now use it. Now, obviously, you need the internet and you need a device to start off with, but they have learnt a new skill as well as then enjoying art. WhatsApp, our Tai Chi class is united in a WhatsApp channel, and they use that to stay in touch in real time. So especially when Tai Chi was on and off and on and off again because of lockdown and restrictions, the tutor could really easily stay in touch with them. And also it gave them a sort of sociable element to the class, which has been really nice. So reducing social isolation, allowing people to have connections in a way more than just meeting to do Tai Chi. Social media, it's a myth that people over a certain age aren't using social media. We've got a really lively Facebook group page for our Friends Aging Better group. It's lively, it's vibrant, and it's also shaped very much by the members. There's quite a democratic method of getting people together. And we have written some paper guides on how to access these things as well. And we can post them to people, we can put them on our website. There's loads out there, lots of different sources with easy to read, easy to use guides. And I think that's a really good source of support. Again, barriers, we all need a device to use these things. You need an internet connection or access to Wi-Fi in public. You need skills and also confidence. Confidence is often something that comes up that people feel they lack to use these things. And all of those things, device, internet connection, learning new skills, can come at a cost. And at the moment, what's sort of made that worse is, of course, we can't get out to group classes in person. There's been an additional barrier there. There's lots of barriers. It doesn't mean we don't do them, doesn't mean it's not worth it. It just means that we all need to think about it quite hard. And Age UK Bristol wants to do more as well about supporting people to access information, to communicate in the ways that they want to, and using the media that they choose. And that's why we're running the Bristol Aging Better Information and Communication Action Group that Bianca mentioned. So this action group's funded by Bristol Aging Better, and it's being run by Linkage. As you know, information and communication is one of the 8 domains of the age-friendly strategy. And this is a group we're going to run between now and the end of March next year. It'll be very firmly founded in co-production with people aged 50. So we're trying not to lead it ourselves. We're building the opportunity for people aged 50 plus to come together and to problem solve on this, but we don't want to provide the answers. And we also want to liaise with information providers, such as statutory services, voluntary sector information providers, you name it, we want to liaise with them. So we're right at the start of the journey for this group. Our first meeting is planned for next month in July, likely to be on Zoom as social restrictions haven't completely melted away yet. But the current people who are interested are all able to get onto the internet. So we also need to work out how we include people who aren't on the internet. So that's one of our challenges. And the idea is for the group to explore how people aged 50 plus can access information to connect with other people for social reasons and activities in the city, to access information to connect with services and organisations, and also consider how people over 50 are represented in the media, like Bianca introduced. We want to look at the barriers, and we want to talk with people who experience some of those barriers as well. So, as Bianca said before, we need a diverse group of people to talk to us about their lives and how do they find information and how do they stay in touch. We need some creative solutions, and we need to work with existing frameworks that are already out there. So statutory services should be adhering to the accessible information standard. So is that happening? Is that working? We need to have a little look at that. The vision, the long-term goal, is that people in Bristol are able to stay connected and they can access the relevant information they require. And these goals were written by people aged 50 and over at the beginning of the Bristol Aging Better process. They wanted older people to feel more confident about going online, to access opportunities on the internet. They wanted organisations to have a more comprehensive, coordinated central directory of groups, organisations and services. And they also want to know that information is provided in an easily accessible format and it's available from a range of sources, and that older people are involved in how it's developed. So I think there's a really important facet to all of this, that if older people want to be involved in how all of this is designed and delivered, then they can be. So this is a little call out, really. It's a bit of a cheeky call out during this event, that if you know people who are interested in this subject matter, or you work with an organisation that has contact with people who may well have opinions, please spread the news and share our contact details and point them in the direction of this group, because we'd love to involve them. We will be as flexible as possible to involve people with different access needs and different ways of connecting with us, whether that's online or in person or on the telephone, whatever people are comfortable with this moment. But it's a nice piece of work that we want to do to really make it localised, but also contribute to Bristol becoming an age-friendly city. We've got an opportunity to contribute to the city work, but we also have an opportunity through Bristol Aging Better and the Aging Better network to push our learning out further than the city, make it regional, make it national, but also learn back in again. So learn what other people are succeeding in, learn their lessons. So it's quite exciting from that point of view. Okay, so I think that's the end of my presentation. I understand there's opportunity later for questions, so I'm going to stay if anybody would like to ask me any questions for that, but otherwise I'll hand back to Bianca.
Thank you, Jo.
Laura, sorry.
That's okay. Hi, I'm Giovanni. We're going to take questions at the end, if that's okay. So we've just got one more presentation to go, but make a note of your question and we'll come back to you. Thank you. Okay, so I'm now going to hand over to Emma from Alive Activities.
Hi everybody, how's it going? I'm just going to share my screen and get my presentation up. Okay, so today I'll be talking about what we did to work with older people to improve technology interventions during the pandemic and now beyond, as we're coming back into a bit more of normality. Working quite closely with Jo for a lot of that, so there's a little bit of overlap at the start, but I'll skip through that to save everyone having everything twice. I work for Alive Activities. We work to enrich the lives of older people and support the people that care for them. That's both in care homes and the community. We engage people through activity sessions. We train carers. We look to reduce social isolation through community initiatives. And we do a lot of advocacy work as well. Since COVID hit, we had to reconsider the way we deliver our projects. Everything was face-to-face, and we had to reimagine everything and how we could communicate with people using technology, knowing that technology was not the best way to communicate with our target audience. We were lucky enough to work with a support hub with Jo, and that brought an awful lot to our work, really helped us all work together effectively. We started delivering our activity sessions over Zoom as opposed to face-to-face, so in care homes and to memory cafes. We worked with Jo to deliver teleconferencing support groups, and we developed special training for carers and older people in becoming more comfortable with technology and delivering activity using different kinds of technology. And even getting the very basics up to scratch, like how do you plug in your laptop to the television and where do you get Wi-Fi? We were lucky enough to receive funding from the CAST programme by the National Lottery. And that allowed us 5 weeks to go off and speak to older people about how they wanted to communicate, if they couldn't do it face to face, what technology they had, really go in depth into how we can look at speaking to people and keeping them in touch with each other when we weren't able to do that face to face. We asked how confident people were, what technology they currently had, how had they been socialising since lockdown, and as we started to come out of it, would they still like to continue using technology? And we learned there was 3 things that we could do that would make a difference to people. So it's improving the teleconference software that we were using with Age UK and Joe, that we needed to offer training to older people on using technology. And we needed to look at producing on-demand dementia-friendly content, provide a bit of entertainment and a bit of joy and a bit of life and light to people's lives during the pandemic. We're all stuck indoors and we're all bored. So I'm going to talk to you about how we're progressing with those 3 key aims. So we currently have a pilot project in North Somerset called Tech to Connect. We've just finished 3 how-to guides printed to get older people online. So there's one very basic, getting online. There's another one around social media and having fun online and using it. And then there's a third one, which is how to train for older people who might be worried and nervous around technology. So they're currently with printers, but also available online. So there's an email at the bottom if anyone would like to request those guides printed or digital. They're quite comprehensive, we work quite hard on them. So there is a resource for everybody to use with that catch-22 of we want to communicate online, but people aren't online. We worked closely with Meetup Call, who the support hub we're using for the teleconferencing software. And that project, we worked with their development team, and we conducted telephone interviews and sat in on various teleconferencing calls and fed back feedback from the older people to their development team. So that work finished in April 2021, and our facilitators are currently trialling changes to the software that should be available across the support hub soon, and that allows people greater transparency in booking on sessions, seeing what's available, and allowing volunteers to run teleconferencing sessions for older people, and makes it a little easier for the older people to sign themselves up as well. And finally, the one thing that I'd like to introduce is our Alive on Demand platform. So this is an on-demand television platform for older people living with dementia, but also not living with dementia. It's aimed at them and their carers. It's aimed at creating conversation and creating discussion between older people and their carers and their loved ones. And so this is the first time I've given this presentation for this, so you have to bear with me. We've got over 130 videos, and each one has been developed and designed from the work we've done with older people over the last 10 years on subjects and topics that people have asked for and what we know have found interesting. We've worked with practitioners that have worked with older people for 10, 15 years, and it covers everything from arts and culture through to reminiscence, through to seated exercise, through to tours of local attractions, Bristol history, and really is a tool to engage older people. Here are some of the partners we've been working with. We've been all around Bristol filming for this. So yeah, we have 3 types of content. We've been doing tours of interesting locations. We've been doing arts and culture videos and guided reminiscence over a number of different content categories, which have been guided by older people. The guided tours are aimed at people that might not be able to get out for various either transport or mobility issues. There's information that also, this is the under 4 yard here, it's information that they want to get out to older people, but also encouraging and showing older people what is available around the city that might be of interest to them. And this follows on from our work with Making Powers, where we work with these attractions to design face-to-face experiences and make sure that wheelchairs can get through and they understand dementia. So the 2 things sit quite nicely together, and hopefully this will encourage people to get out and about when they're able to, if they're able to. Our arts and culture has been put together with people like the Wallace Collection and Bristol Museums to record content that we know older people will want to see. And finally, our guided reminiscence, which is the one thing I wanted to talk to you guys about specifically, is a series of reminiscence videos. For anyone who's not familiar with guided reminiscence, it's used with people living with dementia, older people who are living with dementia. And we use a series of objects, photographs, noises, smells, to talk to people about things that might bring back memories. These videos at the moment, we have the objects, we have subtitles, but we are working on translating those into a number of different languages as well, so we can look at engaging older people from all ethnic backgrounds in Bristol, which is something that we've not really been able to do before. So this is a really great opportunity for us to be able to show a video and be able to engage anybody from any community. We'll be filming for the next year. We've got an in-house videographer, so if anyone has any bright ideas, we want to do working with communities to do cooking reminiscence, we want to do Bristol folklore, and all sorts of different subjects. So if anyone's got any ideas, please do get in touch and let us know. Everything is filterable, so you can find the right videos that you're looking for, and you can find the right video for the right person that you're talking to or dealing with, or so if you have a particular interest that you're interested in. We've created collections of themed content, and you can search based on particular presenters. So when we start to look at doing, perhaps we're going to have somebody who's going to do LGBT content, we're going to look at somebody who perhaps would do content for Somali elders, and things along those lines. So you can search based on that. I'll leave the sample videos for people in the presentation. And then we have supporting activity materials. So this is really for anyone looking to facilitate groups. The idea of this is that anybody can be an effective communicator or facilitator with an older person. So every video has supporting activity materials. So you as an older person can sit and enjoy your video, but also there's further information around quizzes or song sheets or information and bonus materials, so you can build an hours activity around that if you're a memory cafe or an activity coordinator in a care home, or perhaps a daughter trying to communicate with a mother. It's available offline, which is a really important thing that we identified in our research. So we've got apps that will come back today, which means that if you've got them on your iPad or phone or tablet, you're able to download the videos offline. So if you have perhaps someone you're working with that doesn't have the internet, and you can get hold of a device, you can download content that you know they will enjoy, set it up in an easy to access library, and pass that to them so they're able to access and enjoy the content without having everything set up in their own home. which and even if the care homes as well, because a lot don't have decent internet in all of their rooms. So that's something that we identified as a real sort of upsell for this. Yep. And ongoing consultation. So yeah, we're working with care homes and older people across Bristol and other locations as we expand to suggest things that they want to see, subjects that they're interested in, places to go, and reminiscence videos and content that they would like to see if included as part of the platform. So just for the last 5 minutes or so, I'm just going to give you a quick demo of what it looks like, and then so can you all see that?
Yes.
So yeah, here we have, this is Andy at the Under 4 Yard. This is my favorite video, and I'll share the, hopefully we'll share the link with you later, and you'll be able to see up to 10 sample videos for free, so you can see some samples of what the content looks like. So we have reminiscence videos, so things your teenage years, your family. So if you want to get to know the history of someone's family, you know, sports teams. So this is really, I think there's 29 so far, an evening out, Bristol's trams, things like that. We have storytelling and poetry, so we can look at using that as a resource for poetry workshops and storytelling workshops, folk tales from around the world, classical musical appreciation and piano recitals, guided tours of Bristol. We've got a few in the edit still, so this one's a bit put on the ground, but we've got tours of Ashton Gate Stadium, tours of St Mary Redcliffe. We're looking at doing other religious sites as well, so we've got in touch with Gurdwaras and mosques, so there should be a service for each one of those, as well as a tour, so people can access their things that are important to them from their home. Art appreciation with the Wallace collection, which is a big museum up in London, a variety of seated yoga and ballroom dance-based exercise as well. We've got gardening and nature, so we have our quarterly update from our allotment that we're running, as well as other planting videos that people can plant along with, and we'll have gardening sheets and additional resources attached to the bottom so people can plant along and grow things at home. And Bristol history, and then a list of collections around different subjects that people might find interesting. For example, we're going to do one on Christmas and things like that. So yeah, that's, I think, everything from me on what we've been doing. Let's see if I can switch everything up. Yeah.
Thank you very much, Emma, and thank you, Joe and Bianca. Yes, just some really wonderful examples of how you've continued to reach out and connect with older people. It's just incredible to see how you've all adapted. So we do have some time for questions now. I can see that Tracy's popped one in the chat, but I'm going to go to Andrew first because I know you had your hand up earlier. Would you like to ask your question?
Oh, good afternoon, everyone. So I'm Andrew Barney. I'm a newly elected local councillor for Brislington West. Obviously, lots of fantastic information here today, which I really want to share with my local residents. And so the question is basically, can I have links to the stuff that we've heard from today sent to me so I can forward it to local residents?
Good question. And yes, absolutely. We will share all of the information that's come out of today. We'll share the slides and also the recording of today will be available. So everything that you hear about, we can share with you afterwards. So absolutely. And nice to meet you, Andrew. That's where I live. Tracy, you asked, are the resources free to access? I think you were talking about Emma's presentation with the on-demand, is that right?
Yeah, so it's, you know, there's a lot of stuff there. So it's just asking whether, you know, the stuff on demand, the guides, you know, all those things that you were sort of talking about, whether they're free to access. So is there a charge, basically?
The guides are free to access. The printed guides, because it's a North Somerset project, we just need to make sure that they go out to North Somerset first.
Yeah.
But the online guides, totally free for you to access. The live on demand, because it costs us quite a lot of money to pay for the platform and the software. There's a £5 a month charge for individuals and a £50 a month charge for care homes. And that's about as low as we can go really, while still producing more content. But what we are going to be looking at doing is looking at getting trust and grants funding and means testing. So care homes that perhaps requires improvement, or people that are on particular benefits would be able to get free access through trust and grants. So that's our plan. But at the moment, we're just trying to get it all launched.
Okay, and you'll be so Laura, you'll be sending all that information out to us, so you have the email addresses and everything.
That's
Brilliant.
correct. Yeah.
Thank you.
Thank you, Tracy. Helen Holland.
Thanks very much, Laura. And for those who don't know me, I'm Helen Holland. I'm the Cabinet Member for Adult Social Care and the Chair of the Health and Wellbeing Board. So in lots of different ways, I meet lots of people who are around the room and alive. I think we've actually got another date for the allotment visit, which I think is about the 6th, reorganised because of you know what. So we'll see you there, Emma. But it was actually about the presentation that Joe gave and around the developing ways of consulting and communicating with older people. And I know that at an earlier meeting of our Adult Social Care Equalities Forum, which Ian Quaife attends on behalf of BOPF, that we had somebody from the council's consultation team to talk about that, and he was very, it's a man called John Toy. I don't know if people know that particular officer, but he was very open to suggestions, and that was across the whole range of equalities. And I just thought that it might be useful to link you up, because John might want to work with that group about that developing consultation framework, whatever it is you're going to call it. So if that's helpful, I'm quite happy to make that link for you, or you can.
That would be amazing. Yes, thank you, Helen. Yeah, if you could email me or Kay the address, that would be wonderful.
I will.
Great.
Thanks, Joe.
Brilliant, thank you. Oh, what a good connection. Okay, any other questions from anyone? Okay, I can't see anyone else's hand up. So I think we might be, I'm very surprised, but a little earlier than our schedule. But we can go for a break now. So we'll have a 10-minute break. Go and stretch your legs, grab a drink, and then we will come back at about 2:10. Yeah, 2:10. So do come back, and after the break we'll go into breakout rooms and we'll have a bit more of a chance to discuss the topic in groups. So look forward to seeing you in 10 minutes. Yeah,
during the session.
Yeah, someone from our group had to leave for the school run. Brilliant. Okay, well, thank you very much, everyone. I hope that was helpful, and we certainly had an interesting conversation in our group. It's the first time we've used that format in a partnership meeting, so I hope it went okay for you all. I'm going to ask for just one snippet of either an insight or a solution that came from your breakout rooms. So Bianca, do you want to tell me one of your insights or solutions?
Yeah, great. We had quite a few topics actually, but yeah, one was we were talking about people who'd fallen through the gaps before March 2020, who've actually sort of been more included or have had services that they really needed before, such as kind of support available from their own home, where previously they would have had to have got out. So we were talking about how we can continue to support those people as restrictions kind of continue to be lifted, and just the need to continue to offer ways for people to access services and connect to people from home as well, and just keep a lot of that knowledge, and hoping that funders will be flexible as well around what methods of delivery to include those people.
Brilliant, thank you, Bianca. Joe.
Hello. Yeah, we had a lovely chat, and what emerged for us, we kind of got to this conclusion in two different ways, was there was an importance around diversity. So if we want to reach lots of different kinds of people and engage lots of different kinds of people, then we also need diversity of how we provide our information, how we communicate, and then the different media that we offer to engage with people. So whether someone wants to meet on face to face, or whether actually, some people maybe with an anxiety problem wouldn't want to leave the house to go to a service, but the pandemic has really facilitated how we can do that sort of thing on Teams or on a telephone call. And then also diversity around the methods that we use to make our information accessible. So thinking about language and font and things like that.
Brilliant. Thank you, Jo. Claire, do you want to share a snippet from your conversation?
Yeah, so what we're excited about is about possibly can we create a Bristol specific positive image library of pooling our different images that we've got as organisations, and I know there is one through the Centre for Ageing Better on a national level, but can we make a Bristol specific one that is then free for others to access to try and change that imagery? Brilliant,
I love that idea. And Veebs, anything from your group that you want to share?
Yeah, we were talking around access, people learning about tech and how to use it. Like there's this common thing that many old people are scared of looking a bit silly or not knowing how to use stuff. And solutions to that would be, people learn in different ways. So we need different ways of teaching people how to use that tech. So for some that could be videos, but for others that could be more about having a written paper document that they could flip through to check the instructions. And also the different socioeconomic reasons as well for why someone might not have access to tech. They might be that they're a lot poorer, they don't have the money for that technology that's holding them back. So we're talking a lot about, the solutions that we might have for someone who needs to learn how to access more technology.
Brilliant. Thank you. There's definitely a theme here, isn't there, about tailoring to different types of people that we're working with and different needs. So yeah, brilliant. And something that came from our breakout room was just about how important it has been for some people to have tech buddies. So that kind of like ongoing support where people can kind of keep going back to the same person, asking for a bit more help as they learn, but also how that could be really helpful for different services. So maybe partnering up the buddy systems with health service, or Greg was in my group, so we were talking about Beta Minds and their talking therapy service, and how that would be really helpful for some service users who want to start using their online services. So yeah, brilliant. So as mentioned earlier, we will collate all of those insights and solutions and share them with all of you after the meeting. And like a big part of our partnership meetings has always been about networking and connecting with people that are doing similar work to you. So I hope that we've managed to do that this time. I would just like to say a huge thank you to everyone who's come today. Thank you to our speakers, some really interesting presentations and lots of food for thought, I think. I hope this meeting has given you some ideas for how Age Friendly might fit into the work that you do, or how your organisation might want to use that framework in the future. Bianca, do you want to share that last slide for me? So just to let you know that our next partnership meeting will be on the 28th of July, and we'll have a focus on social participation domain. So we'll be sending out further details of speakers soon. But we thought this theme was really, really important as many of us start to think about those hybrid models of delivery. We want to broaden our reach, don't we? And we want to continue to enable those social connections that are hugely important for people of all ages. So yeah, social participation will be the next theme of the meeting. If you'd like to know more about Age Friendly City outside of this, then please just get in touch with us at Bristol Ageing Better. And there's lots of information on our Age Friendly Bristol website, but obviously Bianca in our team would be more than happy to speak to any of you if you've got any questions or any thoughts for the future. If any of you would like to know more about Bristol Aging Better and the learning that's come out of the programme from the last 6 years, then please do visit our Learning and Evaluation Hub on our website. We worked with UE and a team of volunteer community researchers to formally evaluate some of the larger projects as well as the impact of the programme overall. But we do have a plethora of learning reports on a range of topics outside of that formal evaluation. So things like co-production, and we've talked a bit about that today, mental health, engaging older volunteers, running online groups. So do take a look if you haven't already. And if you'd like to sign up to our email updates, then you can do that via our website as well. And also just want to take the chance to plug the Bristol Research Forum, which will be taking place in August. So details are going to be confirmed very soon, including date and speakers. But as some of you might know, these quarterly forums look at the latest research related to ageing and older people's experiences. And it's a collaboration between the University of Bristol, University of the West of England, Age UK Bristol and Brunel Care. And there's always a good turnout for these. I think particularly as they've moved online now, we always get quite a few people go and lots of interesting topics usually. So keep an eye out for that. And to find out more about the Research Forum, you can sign up to their mailing list through the Bristol Aging Better website. So after all that ramble, thank you so much for coming again, and we hope to see you at our partnership meeting in July. Thanks very much, everyone.
I've just put that mailing list.
Oh, thank you.
Already.